that I think we read into Chinese and see, oh, like they're trying to hide something from us. But that's not the way that it is. Usually the Chinese stuff, my experience, the further I get into Chinese stuff, the more I see pragmatism being the underlying connection, more so than esoteria, more so than any other kind of like concept.
Just say why pragmatism? Because for you, pragmatism means that they're looking at what?
Pragmatism means the truth is what works. That's what pragmatism means. So if something is useful, if this model of thinking is useful, then we will use it. And the second it becomes not useful, we'll get rid of it and we'll use this one. And that pragmatism is reflective in the Tao Te Ching, because the first two lines of the Tao Te Ching talk about the intangibility, the fundamental, like, as soon as you label something, it's not
you've changed it.
You've changed it. It's not the real thing. You've limited it. You've constricted it. You can't talk about something's reality in a final way. So if you can't do that, then you come up with systems that are dynamic enough to be able to embody or to be able to absorb sort of the edges of change, so that when something new happens, you can easily fit the new thing into the model.
Or if something is going wrong.
Right, or if something is going wrong. So if you say like, you take like Chinese medicine, and you say this person has heart blood deficiency, and there's like a deficiency kind of heat that's involved. This is like a diagnosis we would have in the medicine. And so the person's having trouble sleeping, right? Biomedically, you might say, well, the person has a calcium deficiency, right? And that you measure their blood and you can see there's not enough calcium, and that their bones are kind of weak. And so that's all right, give them some calcium, or do something to rectify this. And then 20 years later, they find out, oh, it's not just calcium that's missing. We have different tests. We're using these different tests, and we see now that there's also magnesium that's missing, and there's this other thing, I don't know supplement terminology well, but selenium, it's like whatever. There's something else that's missing. And so now we have to do all of these things. And that overcomplicates the treatment. Whereas if you learn how to treat heart blood deficiency with 2 acupuncture needles, it doesn't matter the specifics of the situation as long as the person gets better. So the model of understanding is simpler in a way, but if you get it correct, it is congruent the whole way through. And that's the genius of the medicine. So it doesn't matter what disease a person has, if I can understand the pattern of what's going on in this more general way and affect the pattern with what I know. I don't have to know the specifics of it. That's wasted time and energy. So that's how the medicine operates. It tries to keep things simple whenever possible.
So my guess is so if a Western thinking mind would listen to that and say, oh, but you're not really fixing the problem, because they're still going to need more calcium. They're still going to, if they need more calcium and magnesium and you haven't given them that, they're just going to have to keep coming back for acupuncture. What would you say to that?
Unless you fix so part of the reason that there's an argument there is because the idea of health is different in those 2 models.
So this is part of the thing I wanted to get to.
Right. So the Chinese view of health, the Chinese medicine view of health, is that things are generally healthy. Like, if you left everything alone, it would generally be okay. And occasionally, things would go wrong. Like, occasionally, people die. That happens, Occasionally, medicine is needed to intervene to help somebody to get better. But most of the time, the general movement of nature, if you just left it alone, would be that it would trend positive. The biomedical cosmological view is very different than that. It's not based on that at all. It's based on, we don't know what's going on, and there's this random quality that's happening in nature and in the universe, and we have to control what we understand in order to keep somebody alive and almost do battle against the random pattern-ness that is.
Of a symptom.
Of a symptom, yeah. So that's part of the difference. So if I rectify the pattern, going back to the original question, so if I change the heart-blood deficiency, right, that should also change. Maybe there's also a portion to this is an example for the sake of simplicity, but maybe there's a portion to the digestive system that's weak. So the digestive system isn't absorbing enough, in Chinese medicine, good stuff to make good blood so that the blood of the heart is sufficient. So maybe you have to also treat the digestive system, rectify the problem with the digestive system, and then the absorption of the body is better. It absorbs what the body needs, and then there's no problem with the heart anymore. So that's how it would be thought of.
So if you were to say, so let's go back to a little bit more around what health is. So you're saying in Chinese medicine, they would more or less assume that the body is going to move towards health. That's the, so would the definition of being healthy in, what would it be in Chinese medicine?
It would depend, well, so it would depend on who you ask, but understand that the definitions for these things are also changing because of the modern world and influence of Western medicine, and people in China who practice today are also MDs, basically, in China. So if you asked Huang, who's a very famous Chinese medicine practitioner, well, he's, in China, he's fairly well known. He's written a bunch of books. He's more famous over here than he is over there, I'm told. But when he was asked, what is health, he gave a very biomedical answer in an interview recently. He said, health is not being sick, basically, which is very, very biomedical. That is what biomedicine says, If there's nothing wrong, you're healthy. Yeah. And I think there's another definition of health that you can kind of understand from, I'm taking this from another teacher, Liu Ming, where he's talking about one of the doctors that he's followed and learned from, Dr. Liu. And Dr. Liu would not be satisfied with his treatment until until the person became a good person. So Ming tells the story of going to Dr. Liu and basically referring 50% of Dr. Liu's patients to him. So Dr. Liu say, "Oh, how is Jenny?" And he couldn't ever remember anyone's name, so he'd say, "Oh, he is no, Jenny's a woman," and he's like, "Oh, Jenny is becoming a very good person," And there's this quality to the old school doctors where if you make it if you just change somebody's, you treat somebody's pattern, right, at a basic level, maybe the problem that they have goes away, but if they don't change their lifestyle, if they don't become a different person, then likely the problem will come back again, because the same thing that they had that created the problem is still there. You're just basically changing the surface layer. So if you work deeper to try and change the personality of the person, which takes time and has to be some willingness on their part, and there's a whole number of other factors to that, right? But if that's your goal, you influence the person becomes different, and then that's a different way of becoming healthy. So that doctor wouldn't consider what he did successful until he felt like they were becoming a good person. And for him, that meant the person wanted to be generous. Basically, they would tell him that they couldn't come in for treatment because they would be volunteering, or he would look for some evidence of that, and then he would say, "Okay, no more treatment. You're good."
So I would probably say, my goal would be to keep working on loving myself and others better. That's a continuous life process.
Sure.
And when people come in for therapy, that's even though they too would have symptoms, they would be depressed or anxious, or a relationship would be failing, or they would be having this trouble with their daughter,
Right.
or whatnot. So, like, I think that's, and maybe I have more permission because I'm in mental health to go towards that direction. But I do think it is, we talk about self-esteem in Western culture, and there's lots of different thoughts about self-esteem, but I think we have need to have a balance of love and care for self and love and care for others. I think that's the mix that's important. And so, like, that's why this makes sense to me. And also, I think the complicatedness. So, where I've always, marriage and family therapist, I've always been on the outside of mental health, because mental health or insurance companies always, the other individual practitioners seem to want to make it be about the individual psychopathology. And in order to be held in esteem in mental health or get paid,
Right.
you needed to identify a symptom or a syndrome and in an individual, and then treat that either with therapeutic techniques or with medication. And my professional identity is around systemic thinking and relationship. So I think that's one of the reasons why the Chinese medicine parts do intrigue me or attract me, because for a long time I think about people's mental health as a relational thing.
Yeah.
And so the complexity of relationships has been something I've entertained the whole time.
Right.
I don't see depression as being in an individual. And anxiety, while yes, a person can say, I feel anxious, is also so impacted by their relationships and the context around them.
Sure.
So it's one of the reasons why I think this interconnection makes sense, but it does require us to think more complexly.
Yeah, but I also wonder if there's a part of me that wonders if that it isn't more complex. It's actually simpler in some ways. Like it makes more sense to think of things more like that. Like the departure from that is actually more complex than what our thinking needs to be like. We just tend, like, our complexity is embodied, so we think of it as simplicity, but we don't actually know that it's an addition to what's necessary, and that addition may not always be beneficial.
Yeah.
Do you understand what I'm saying?
Yes.
Yeah.